This video is what you guys all asked for, confessions of a massage therapist. Hi guys, if you're new here, I'm Natalie, your virtual massage therapist. On this channel, we talk all things massage therapy, fitness, health, and I help you get into shape and out of pain. I recently asked you guys what I can make you a video about, and this was one of the #1 questions is, tell me all the dirt. What are you thinking? What's going on behind the scenes? So let's just get the most obvious question out of the way. The one question I actually can't stand. I hate hearing it, but I understand why you asked this question too. Have I ever been propositioned on the job? The answer is actually, and it might surprise you, no, never. I know some other massage therapists have, and possibly it's because I've always worked in a clinical setting wearing scrubs, but I've never had any type of situation where I feel unsafe or feel like somebody has the wrong intentions. With that said though, I have had 2 strange phone calls. One of them was just the typical asking what it costs for extras. So annoying. And the other one, I actually think is pretty funny now that I look back at it. So wait to the end of this video where I'll tell you that story. Okay, so let's call this the first real question. And a few of you actually asked me this. What is the grossest thing you've ever touched? Nothing. Because if I see something questionable, I'm not gonna touch it. But I have seen some interesting things that I normally wouldn't go ahead and just touch it, but they do pique my curiosity. Because look guys, I got into this career because I wanted to help people. Everybody wants the same thing. They want to feel good and they want to get out of pain. Have I seen weird things? Yes, but it absolutely doesn't bother me. It's what makes people human. I have not seen anything that grossed me out per se. In fact, if it grossed me out, I'm probably in the wrong career. And like I said, it just makes me incredibly curious, and then I just want to help. I'm also equipped with hot and cold cloths, first aid kit, everything. So if I see something that I need to clean or I need to bring to my client's attention, of course I'm gonna let them know and I'll do my best to help them. In fact, a lot of the things we see are actually really important. I have found cancerous moles on people, especially like the elderly that don't have a lot of people looking or touching them anymore. I found things like blood clots that they didn't know what it was. They just thought it was an ache in their leg. And I'm always sure to let my client know what I'm seeing or what I think it is so that they can go get the proper medical attention should they need it. So gross isn't really the right word for human beings in general. Okay, wait. Actually, that's a little bit of a lie. There are 2 stories I can tell you that where I accidentally touched something I shouldn't have. So there's this one time, and he's gonna know exactly who I'm talking about if he's watching this. Hi! I was treating him for knee pain and I was stripping his quad muscle, and I put all my body weight behind it and I slipped. And I completely put my entire hand, cupped him in his man parts. I felt absolutely horrible. I didn't know what to say. I jumped back. I just looked at him. He started laughing. I was so concerned I hurt him, and he was like, no, not at all. It's just one of those super embarrassing situations. And then there was this other time where I gotta tell you this story too, because I love my doctor clients. You guys are fantastic, but my gosh, some of the things you guys think I can fix is quite comical. One of my doctor clients came in and he said, I need you to fix my foot. I hurt myself and I have to play tennis on Thursday. It was Tuesday. So I was like, okay, I'll take a look. And it was a pretty severe injury. And I kind of looked at it and said, with the amount of swelling and bruising going on, I think you broke your foot, your ankle. And he said, oh, no, just do whatever you need to do. Make it feel better. I need to play tennis on Thursday. So I knew I shouldn't have, but I kind of just started kind of checking to see what maybe he did. And I just went to go move his foot very, very slightly, and it snapped. And so I looked at him and I said, well, it's broken now. And he kind of chuckled and said, oh, no, it's fine. Just do some lymphatic drainage, do whatever you gotta do, wrap it up, I'll be fine. And I told him, just like, please go get an x-ray. So the following Friday, I got a phone call from him. He went and played tennis on it anyways. Then the Friday he decided to go for the x-ray and he called me and said, "You were right, it is broken." And he's like, "Well, what can I do to make it heal faster?" Time, cast it, relax, stop playing tennis. Following, once the cast came off, of course, we did lots of rehab therapy, but I thought that was a funny little story, and I don't think I actually broke his foot, but I didn't help anything. Okay, next question. Do you dare get into the profession who thinks they know most about your job while you're massaging them? I don't blame you if you don't want to get into it. It should be an interesting video either way. Thank you very much for that question. It's actually a fairly simple answer, but before I answer that, I'm going to admit that yes, I'm going to piss off a whole bunch of people. So I apologize in advance to all my friends in this industry. You know I love you. The answer to that question is unfortunately physiotherapists. It isn't all, but it is definitely some. However, most of these people won't be on my table because they don't think they need massage. But physios tend to think that they're just better massage therapists. And let me tell you guys, physiotherapy and massage therapy are similar. We have the same goal, which is to help people get out of pain or get them moving again. But how we get there varies. As massage therapy, obviously we use some massage techniques, and our scope of practice is much different. Now, physiotherapy and massage therapy in some areas are vastly different education levels. Where I live in Canada, it's not completely true. However, we do have lots of massage therapists that aren't registered massage therapists, and they took training in like a spa or maybe overseas, and they offer and deliver a great massage, usually a relaxation massage, but they're not registered therapists. And so then we see these people working in spas and things like that, and that's where it crosses over into, say, the aesthetic field versus the healthcare field, which is what I am in as a registered sports massage therapist. So physiotherapists will go to school and obtain a degree first, and then they enter into a physiotherapy program for 2 years. Massage therapists don't need the degree to get into a massage program, but then from there they go into school for 2 to 3 years. So a physiotherapist has an average of 6 years of education, whereas a massage therapist has between 2 and 3. However, that's not always true because some of us have degrees as well. Physiotherapy has a degree, a master's, and a doctorate, whereas massage therapy doesn't even have a degree. So there's only so far we can go. And that's why you see us branching out into different fields, like myself in structural integration, which is a form of massage therapy that actually some physios also actually practice. So physios, I love you. You know I love you. I have some great friends that are physios, and even some of my friends that are physios will say the same thing. This is not a bash on physios at all. I love physios. They have their place. They're just not massage therapists, and massage therapists are not physios. It's a completely different scope of practice. I don't want to pretend to know what physios do, but I am the expert at what massage therapists do, and I can assure you, we do know what we're doing. Okay, next question. Are larger people or people with more body fat harder to massage? Yes and no. I guess it comes down to what the goal is. So in massage therapy, we tend to be wanting to relax muscles or release tension or facilitate muscles. Facilitation is when we're actually trying to ask them to contract because they've been stretched too long. And all of that comes down to the nervous system. So it doesn't really matter how big or small you are. If you are a tense person and you're wound right up, those are the most difficult people to work on. And it takes a little bit longer to create the result we're looking for. If you are a larger person, sometimes it can be a little bit harder to feel what I'm looking for. Generally not, because we can test the muscle length and kind of the palpation is what it's called, and kind of feel the changes that we're looking for. And in the case where the muscles are really large, like in like a bodybuilder, it can be a little bit more difficult per se to get to some of the muscles underneath a muscle just because they're so much thicker, but there are ways around that. So no, size doesn't really matter. However, strength can matter. I have been thrown across the room so many times, mainly when I'm doing, say, like a muscle energy technique and I get somebody to contract a muscle and they're really, really strong. And I've learned my lesson that I've got to tell them, like, 1% of your strength. You don't want to overpower me, because sometimes people are so strong and they just whip me across the room, or when I'm doing TMJ work and they bite my fingers. So sometimes it's hard to get people to understand their own strength and to just kind of tone it down a little bit so that I don't go flying across the room when I'm trying to hold them still. Okay, next. Is massage therapy hard on your body? Yeah, it sure can be, but that's where self-care comes in. A lot of us have jobs that are hard on the body, and as you probably know, if you have one of these jobs, that you have to take care of yourself. And the same is true for even people that don't move that much, sitting at a desk all day. If you're a client of mine, I'm constantly telling you, get up and get moving. You gotta take care of yourself so that your back doesn't hurt, your neck doesn't hurt. Just like my job, I gotta do the exact same thing. There are certain techniques that are, yes, harder on my body than others. So I'm a big believer in practicing what I preach. I wouldn't tell you guys to do anything that I don't do. I do the work, I try and keep myself as healthy as possible. In fact, this entire YouTube channel started over self-care. I would give clients homework to do at home. They would forget to do it, so I started making videos for them, and I'd put it up on YouTube, they'd watch it there, and then the rest is history. And of course, there is the techniques which save our body. A lot of people will say, how do you massage? That hurts your hands. Well, we don't really massage with our hands. If you're curious about how we massage to save our body, I actually have a couple of videos for that, so you can jump back to, and I'll put one up in the cards here, basically how to massage, and then how to massage the lower back and things like that. And we just really quickly go over some techniques and how we save our body. Okay, next question. Do clients talk to you when you're working on them, or do they stay silent? Well, both. I would say more often than not, people do talk. Some people will talk for a little bit and then they'll kind of relax and go to sleep or close their eyes. Some will say nothing at all, and all of it is very normal. And sometimes people will talk one day and then they're just not feeling it the next day, or vice versa. Anything goes. I read the room. And of course, like, I do have to talk sometimes. I have to ask how the pressure is, how things are feeling, if I'm in the right area. I have to ask you to move sometimes or contract muscles. So there is always conversation to be had. If I wasn't talking to you at all, that would be unethical, especially when I have to warn you about what I'm about to do next, or pulling sheets back, all that stuff. So there's always a little bit of talking, but I generally just let the client lead. Okay, next question. Are there things people do before a massage that they think are helpful that actually aren't? Yes. Okay, ladies, I'm talking to you. Shaving your legs, taking an in-depth shower, putting on lotion, it doesn't matter. Your massage therapist doesn't care. And the reason I'm talking to you ladies is because men will come in, they're hairy, they don't smell as good as the ladies, they got stuff stuck to them, they don't say a word, they don't care. Most men anyways. Women come in, they're apologizing for existing, they're apologizing they didn't get a pedicure, they apologize for everything. We don't care. Come as you are. I promise you, I am not staring at your skin almost ever. I will look to landmark certain areas of the body or see where I'm working. But other than that, I'm usually staring off into space or have my eyes closed because I need to see with my hands and see what's going on and really feel for what I'm feeling. Because I find anyways that if I close my eyes, I can see better with my hands. I don't know if there's any truth to that. It's kind of like when you're driving and trying to park and you turn your volume down so you can see better. I don't know. So please don't feel like you have to do anything. Next question. So what are the challenges that you face as a massage therapist that most people wouldn't know about? That's a good question too. Probably the connection I have with my clients and how much I care about them. I have to stay professional and I have to keep my boundaries, of course, but it can be really hard because I care about them, and maybe clients don't, maybe just don't know that, you know, we do care. Or I care anyways, just like your doctor probably cares about you. Your healthcare professionals do care, or they wouldn't be in the industry if they don't care, like run far away. But yeah, that's probably the biggest thing that people don't know about. I think people assume that, you know, it's our hands are hurting and stuff, but the emotional toll it takes. And then of course the office work, oh my gosh, the charting your files. I take big pride in that. I make sure I'm documenting everything, especially for long-term clients, so that I can really see what's going on over a long period of time. I write down all your testing, I write down everything you tell me, and that usually happens after you leave. You guys will see me taking notes when you're there with me, but then I do a full write-up after as well to summarize the entire appointment and write what I'm going to do next time, or what my goals are for next time, or where we're gonna pick up from. Okay, so those are the only questions I had that I was gonna answer today, because I don't wanna make this video super long. And as promised, I was gonna tell you the story about the phone call. It was an afternoon one day, and I just happened to answer the phone. And it was some guy, and he said he was in the grocery store talking to a friend of theirs that referred me to them. And I said, okay, well, what's the situation? Knowing that, you know, if it's a client of mine that referred them, I will know what situation they had, and if they have a similar problem, then I can probably help. So he goes on to explain that he was in the grocery store and met this friend and told her how he has pain when he has an erection, and he needs someone to help him with that. And I immediately said, oh, okay, who's my client? Who's the person that referred you? And he said, I don't remember her name. And I was like, what? You're in the grocery store talking about a painful erection with somebody that you don't even remember her name? Like, I think I blurted that out, because I was just like, what? Like, that is the weirdest thing I've ever heard. But otherwise, I referred him over to my pelvic floor physio friend, sorry Tanya, and apparently he never called. So that was the weird phone call I got. You guys, like, don't call us saying things like that. We're not morons, and we don't, in any area of the body, we don't necessarily rub what hurts. So if you think that's how you're gonna get that massage, it's not gonna work with a registered massage therapist. Anyways, guys, that's all I had for you today. Thanks for participating in this fun little video. If you enjoyed that, or you think you'd enjoy similar content like this, or you wanna learn about massage therapy, fitness, or how to get out of pain and back into shape, then make sure you are subscribed to this channel. And of course, again, if you liked this video, do me a favor and hit the thumbs up button. That's a free way you can help me out. As always, guys, I super appreciate you all taking the time to watch my videos, all the engagement. I love this community we're building here, meeting people from all over the world. I'm learning from you just as you're learning from me. And as always, happy healing.